or webcam during the webinar, because we are streaming live on Facebook, and the whole meeting will be recorded up to end. And if you have any question or comments, please write it down just in English in the chat box, and at the end of the webinar we'll ask your question too. Now, I want to ask Professor Ponzer, the scientific chair of the webinar and head of Department of Emergency and head of Research, Education, Development and Innovation, Department of Clinical Sciences and Education in Southern Hospital, and also Karolinska Institute in Sweden, to start the meeting and introduce our prestigious presenters. Dear Ponzer, may I ask you to start it? Unfortunately, your microphone is turned off. Turn it on, please.
Yes, now?
Yes, thank you so much.
Okay, now I'm on there. Most welcome to this seminar about interprofessional collaboration in the COVID-19 era, pros and cons. It has been an interesting journey to here, and it is now a great honor and pleasure for me to welcome you all to this seminar. Dr. Mandana Shirazi has been the main organizer of this, so it's thanks to Mandana that this event is happening today. And I see that there are 53 participants, and that's really a great number. So the COVID-19 pandemic has changed everybody's life. And this seminar focuses on the pros and cons of this era. The situation varies all around the world. In most European countries, the vaccination programs had led to less restrictions. Sweden is opening up tomorrow, the 29th of September. All the restrictions are going to be taken away. However, it looks very different in different parts of the world. I'm sure Mandana will tell more about the situation in Iran and Denise Richardson in Canada. However, during this pandemic, we have also learned new ways of digital communication, and Zoom-based sessions have become more common, and today's seminar is one of those. With these words, I would like to introduce to you the speakers of today, and it is Dr. Denise Richardson from Canada. I'm sure you will tell a little bit more about yourself. And then we have, of course, Mandana Shirazi, that I know for many years, and I hope Mandana will also say some words about yourself. You come from this Tehran University of Medical Sciences. And then I have my two friends, Rene Ballnus and Malin Horngen, that come from the same hospital as me. And I'm sure they will also introduce themselves. So let's get started. And the first speaker will be Mandana. So it's the Zoom is yours instead for the floor is yours. The Zoom is yours. Thank you very much. Okay, are you there, Mandana? Yes? No, can't hear you. Can't hear you. The microphone, Mandana. No voice? Not still?
Oh my God.
Now we can hear you.
Do you hear me?
Now we can hear you, yes.
Okay.
So,
hello,
yes.
Everybody. It's my honor to organize and also participate in this webinar, which is regarding the IPC situation in different countries before and after COVID and its cons and pros. My name is Mandana Shirazi. I'm the professor of TUMS, Tehran University of Medical Sciences, and the head of Department of Innovation and Innovation Strategy Education in Educational Development Center in Tehran University. And also I am the affiliated professor of Karolinska Institute Southern Hospital, Department of Education and Clinical Sciences. So today I'm honored to speak about a little bit regarding the introduction of, do you see my, I should share the screens first, sorry, share the screen. If you look at this, I would like to present, this is the general topic of our presentation. Then I would like to focus on an introduction to IPC-IPE, current status in COVID era, in Iranian context, cons and pros. The objective of my presentation is categorized in 4 parts. First of all, I would like to give some definition for interprofessional collaboration and education. Then I would like to go through the recognizing the importance of collaboration, which was based on the WHO recommendation before and after COVID. Following that, I would like to go through the defining domains of IPE, IPC based on CAN-MED categorized. And especially I would like to focus on conflict management, which is very important issue among the CAN-MED categorization. Then I would like to explain the situation of IPE, IPC in Iran before and after COVID. And also the positive and negative points of each pre and post-COVID. The IPE and IPC definition is that when we are talking about the IPE, is the interprofessional education when occurred that students from 2 or more professions learn about, from, and with each other. Talking about IPC, it happens when multiple health workers from different disciplines work together with patients, families, caregivers, and also communities in order to deliver the outcome is to improve the collaboration and the IPC outcome. So IPE wants to practice collaboration, and we must know how to collaborate different parts with each other. Then if you look at through this slide is what's happening in all countries as well as Iran. We have a nursing school, medicine school, lab schools, and pharmacy, dentistry, and etc. They are learned individually. They have no collaboration with each other. And if it happens, then we expect that when they finish their study and went to the real field, they act and work as a team with each other. It doesn't happen. How can they work together if they don't learn together? So it shows that IPE is an important issue. If I would like to speak about the IPCP based on the WHO definition before COVID-19, I mean in 2010, interprofessional collaboration and education practice referred to an innovative strategy which plays an important role in justifying the global health workforce crisis. It means that during the crisis, the IPC program is very, very important. And WHO, before this COVID pandemic, emphasizes on it. And interprofessional education, as I mentioned further, occur when a student from two or more professions learn about and with each other to enable effective collaborative and improve healthcare outcomes. WHO in 2019 have another recommendation regarding IPC. WHO recommended that IPC strategies for controlling different aspects of COVID-19. As you remember in previous slide, we have told you that the workforce crisis is one of the recommended situations that WHO emphasizes on it on 2010. And now in 2019, again, it brings it up that it is an important issue. The educational system of developed and developing country during pandemic should be concerned about effective educational methods in order to improve teamwork capability among healthcare providers. If we would like to quick look at the different parts of the different domains of the IPE in IPC in based on the CANMET categories, we can see that it consists of 5 parts. This pie have 5 parts. The first one could be roles and responsibility. Another one is team functioning. The next one is interprofessional communication. After that, conflict management and collaborative leadership. I bring out the piece of pie which I called it conflict management, important issue that in Iran also we have several difficulties in this regard, because people when get together, they have found, they will find some difficulties in order to collaborate with each other and also to cooperate for solving this problem. And I would like to show 2 short, very briefly video in order to show you that how it could be happen. And I should open the video.
I can't hear or see any of your videos, Mandana. Maybe somebody else can.
Excuse me, are you Molly Brown?
Yes, I am.
Oh, hi, I'm Dr. Green. I'm the attending. I
look
haven't
at this
actually met
video.
you, but
This
I
is
need
the
to talk
case
to you if that's okay with you.
that I would like
Actually, I'm
to
just having my
watch
coffee break, so if
at
we could
how
wait.
You know what? I
conflict
just got
happens
paged and I've got to get down to the ER and
regarding
it's something I have to deal with right away.
interpersonal communication.
I'm going to be straight with you. I've had a complaint about you.
I'm sorry?
Yeah, one of the patients down the hall has reported that he's heard what he thought was abusive behavior happening down to Mr. Jones and 4A. So,
I'm
need to
sorry,
talk to
Mr.
you.
Jones
Yeah.
complained about me?
No, it was another patient who had heard something going on. I'm wanting to check this out with you because I've got to find out what.
Have you
actually
met
went-
Mr. Jones by any chance?
Yes, I actually have met Mr. Jones. Yeah.
So which patient was this that complained?
Do you know what? I'm not going to worry about telling you that. I just need to check out what happened this morning. Can you tell me in your own words what happened? So
Yeah, I
I
was
can...
getting Mr. Jones ready for you guys to come around for grand rounds.
Right. Yeah. Okay. Well,
So
I gotta...
if you'd met Mr. Jones, you probably have an idea of what I was up to.
Yeah. Well,
Have you seen
I
him?
know Mr. Jones is difficult. I will give you that.
Yes.
But what
Yes,
happened?
he is.
What went down?
Like I said, all I was trying to do is clean him of all the, urine that was covering him up, his
right.
barf, everything else that was going on.
Yeah.
And that's about it. I don't know what the problem
Okay,
is
well,
here.
look, what I've
so-
been told is that this person heard some verbal abuse and heard what he thought was a slap. And what is that the truth? Is that what happened? Did you actually do something to this patient?
So I'm sorry, you're coming in here accusing me of abusing somebody? You haven't even...
I've been
taken
told
the-
this by another patient, and all these patients on this ward are my responsibility. I have to check this out, and I really want to find out what's going on. I thought
Well-
I'd do you a favor and talk to you first before I took it to your supervisor, but that's what I'll have to do if you're not going to tell me what happened.
Well, thank you very much. I appreciate that.
Okay.
But I'm afraid that, all I was doing was getting him prepared. Like I said, I don't think you recognize who this man is.
Look, I know he's a difficult
Excuse me, do you
patient,
mind if
and
I just finish?
actually, you know what? I need to find out in your words. Did
Well,
you slap this patient? Were you abusive to him verbally? Did you swear at him? Is that what happened?
Can I talk now?
Well,
I'm
I
sorry.
would like to hear what you have to say.
Okay.
Yeah.
So basically what happened is that I was trying to get him cleaned up. He was full of vomit.
Yeah.
He defecated over himself. I mean, have you seen this? Of course you
Yeah,
haven't
well, of course,
seen this.
sometimes patients are difficult, and
No, 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 wait a
we're not
second.
expecting these people to be perfect when they
thought-
come in. And what happened? Do I need to report this, or what's happening here? Because if that patient is in danger from the care of one of the personnel here, that's my responsibility, and I need to report that. So I got to find that out.
Yeah, well, I'm actually trying to tell you what happened. So obviously you're not interested in hearing my side of
Look,
the story,
I'm
are you?
interested, and I think you should just calm down because I need to get the facts before I make a report about this. And I just, you're obviously not in a great space. So, let's find out what really went down.
So the next one.
Mandana, I think some people had a hard time hearing the voice from the video.
Didn't she hear the voice?
I could see that there were some messages saying, dear, no voice.
Sorry to interrupt. There's some persons who did not join audio, so they will not have the voice room actually, and they cannot hear us until they join the device audio. So I sent some guide in the chat box, but I don't know, some of them do not pay attention to that.
Okay, then we know.
Okay. Thank you so much. We are ready for the next video.
Yes.
Yes, thank you.
Conflict happens everywhere. At home, with your parents, siblings, kids, at work with coworkers or bosses, on Facebook. We all deal with conflict, from the little arguments or disagreements to screaming, office supply throwing fights that cause severe stress. And unless you work alone in a cave, which is not likely, conflict will affect your work at some time or another. In the U.S., conflict is estimated to cost employers well over $1 billion every year. Conflict happens everywhere, however. It's completely natural. It's the result of miscommunication, differences in opinion or perspective, different objectives, or limited resources. So if we can't completely avoid conflict in our lives, how do we make the best of these inevitable situations? By being more aware. First, everyone is different. No two individuals are exactly alike. Even those genetically identical twins that look exactly alike won't have the same thoughts, feelings, personality traits, and more. Knowing this is the first step to taming that big scary monster that is conflict. Second, though everyone is different, there's a pattern to how most people typically handle conflict. This is called your conflict handling mode or conflict resolution style. There's a tool called the TKI. the Thomas Kilmann conflict mode instrument that illustrates these 5 conflict resolution styles in detail. Every conflict resolution style has different degrees of assertiveness and cooperativeness. In other words, how much you're trying to satisfy your own concerns and how much you're trying to satisfy your teammates' concerns. You can map out these 5 styles: competing, collaborating, compromising, avoiding, and accommodating based on degrees of assertiveness and cooperativeness. None of the styles are better than any other, they are just different. Third, know your style. Though we all use different styles at different times, most people typically have 1 or 2 styles that they use most of the time. From a combination of personality, nature, upbringing, culture, work environment, and the dozens of different variations that make you who you are, you have learned that 1 or 2 of these styles are the most comfortable for you. Being aware of how you act when in conflict will help you along your journey to mastering the conflict monster. Fourth, learn the other styles and how to use them. Some conflict styles are better used than others for different situations. Maybe your natural conflict resolution style is collaborating, but in a work situation, your project involving multiple other departments is on a tight deadline and you don't have time to sit down with every person on the team to discuss every idea they have for the best way to finish the project. If you know what the other conflict handling styles are and which works best for situations with certain qualities, you can wisely choose to flex your own style to best fit the situation.
Okay. Okay. Then, as you have seen in these 2 videos, one was regarding the example of case, and then another one was regarding the definition and also conflict resolution. Then I would like to continue. My presentation with the situation of IPC in Iran. Based on the literature, in Iran, we have the main challenges to implementing of IPE is in 3 parts. First of all, the educational system. We have a lack of actually formal education for IPE in our curriculum. And also we have a cultural challenges, which is mainly related to the attitude of manager, professors, and also even students regarding IPE. And there is a need to change, and we should consider it for the future time. And especially it relates to conflict management. And we are really suffering in interprofessional collaboration before COVID, how to handle and manage this conflict in the world. And the last things that is the cons of IPC in Iran was lack of infrastructure. It is due to lack of resource and unfortunately lack of knowledge in some sense. Regarding the pros of IPE in Iran, we had actually some progress. In Iran, from 9 years ago till now, I have directing the research group, which we call it Medical Education Research Group Experience, MERG. And this research group was firstly a startup in the international affair and also talent center for research. And we have done several research in this area, I mean in the IPE area in this group. And also we have some thesis, PhD thesis which one of them was in the emergency ward, another one was in the healthcare system. And both of them, the results showed that when the IPE happened and also occurred, then the results of the healthcare will improve. And then another step that we have taken for improving the IPE in Iran was to have some kind of faculty development workshop, because still, as I mentioned before, some of our faculties are not familiar with this area. So it is necessary that make them aware. And the pros of IPE in interprofessional collaboration post-COVID, all was pros, because we haven't actually any cons in this regard. The improving of IPC situation in pandemic crises based on the WHO recommended has happened, and also increasing effective teamwork, quality of interprofessional communication happens. I'm sorry to say that many of my colleagues in healthcare providers dying due to the pandemic in order to save their patients' lives. And I know that in different parts of the world it happens, but in Iran, we lost many of our colleagues in this regard in order to save their patient life. Thank you very much. And these are my email address. If you have any question, I can answer at the end of the meeting, or you can send an email to me. Very much.
Thank you, Mandana. That was really good talk about the situation in Iran. And if somebody has a quick question for Mandana, you might say it just aloud or write it on the chat. I can't see any questions at this moment. Okay, we save them to the later time. Shall we thank you, Mandana, and now we give the word to Dr. Denise Richardson. Are you there?
Denise?
Are you there, Denise?
No, unfortunately, I can't see her, but we can stay or waiting for her.
We are waiting for
Yes, yes, of course.
I think she had some problems with the connection.
Maybe.
Is it possible that Rene have a presentation instead? And then
I don't know.
Absolutely, but maybe she will be back soon. Shall we wait a couple of minutes?
Yes, yes, please.
Okay, do you have any questions to Mandana at this time? No questions.
Can I add something?
Yes, please do.
I would like to say that I learned IPE when I was cooperating with the Department of Education and Education and Clinical Sciences with Sari. Sari, as I understand that, you are the mother of the IPE in Sweden, isn't it?
Well, I was there when it started, but it is 20 years ago, and I mourned. So, and I must say that your 9 years is nothing. It will take time before the attitudes and the infrastructure will be there. So just be patient. Okay, no Denise. Okay, Rene, are you ready to, and Malin, to give your presentation instead?
Yes, we can continue. As I understand, Denise has parallel this outpatient clinic, and it was early in the morning for her that it should work. But if she's not here, then maybe we should be flexible and go ahead with our part.
Yes, if she shows up, then maybe we can just make a little break then. Okay.
Yes, please give me only a sign if we should stop or everything. We have to talk to Denise to figure this out. Otherwise, maybe Malin and me, we show our presentation. And as you see, here's our title for this short input from Sweden. And we would like to highlight the importance of faculty development, since you already said that there is an history.
Sorry to interrupt you, Rene.
Yeah.
I think that Dennis come back.
Okay, I can.
Isn't
As
it?
it is in education, you also always have to be flexible. So absolutely, we give Denise the stage.
Are you there, Denise? Okay, Rene, you need to stop
share. So
your screen. Are you there, Denise?
I couldn't see her. Yeah.
Please continue. Sorry. Please continue, Rene.
Okay, we go back to Sweden then.
okay, we go back to Sweden, and this is also something that we
Miriam,
have.
maybe you can keep track on Denise when she's showing up. Yes. Okay, Rene.
Okay, as I mentioned, we would like to highlight the importance of faculty development in this regard, IPECP, and then we also would like to give you our experiences and what we have learned with this work during COVID. I am a nurse and an educator, and actually have worked long time with clinical education, and the last 10 years roundabout with interprofessional education for students, but even with staff development for regarding IPECP. So this is my background, and maybe Malin, you would like to add your background?
Yeah, hello, my name is Malin, and I'm a nurse as well. And I have worked as an interprofessional clinical ward with students from different professions for about 10 years. And now 2 years with interprofessional learning and collaboration with staff, together with Rene.
And maybe you know where Sweden is. It's in the northern part of Europe. And then you see the red part on the right picture. This is the county of Stockholm. So this here you have 2 million inhabitants of the round about 10 million in the whole Sweden. So you know that we, if you look on Sweden, then quite many people are living here in this area. And if you're talking about IPE, then we can say that we have interprofessional training wards. The Sari was involved, and even Malin or me has worked during a few years, were the starting point for actually interprofessional education for our students. And then even after this training wards, we have seen more upcoming events actually addressing this learning for the students in smaller initiatives where you do things for the students that are not such big as in training wards that need actually some planning and structure that this really work when you have 4 different students categories working together with the patient. So this is some kind of our start in the late 90s, but we have an issue in Sweden, even if we maybe have come quite a long way on this journey. We also have to ask about how is it with us, we who are the professionals, how we are working interprofessionally, daily wise, how we teachers work together, and what do we know about interprofessional learning and education. It's not enough to only to focus on this training ward. They are actually only one small part in the training and one small part, and if you're looking on the whole healthcare system, and even one part, it's for the patients, but sometimes we can forget the patients when we only have to focus on how we professionals or the students should work together in the best way. How do we include the patient in this work as a partner in this interprofessional care team? And this is one of the reasons that I had the chance, and later Malin joined, and now we have even another colleague joined this work, that we started an interprofessional center for IP, interprofessional learning, and interprofessional collaboration. So you see that we sometimes wrote IPE or we talk about IPL. So we focus more on the learning, not only the education part, what is the learning part, that we more understand what really happens, that we also have focus on this, on the smaller events that can happen spontaneously in the different areas. So we started around about 5 years ago and focus really on the staff development. So this was before COVID, nobody thought about that there. And we even supported local initiatives, and we worked with the leaderships, we worked with individuals, we have worked with different care teams, and we not only have to focus on hospitals, we offer our support and our courses to all the healthcare that is organized in the Stockholm County, and there you can even there we include the primary care services and the home care parts of the home care service and so on. So we have different courses. We work with networking and follow up even our courses. But when we started, we've seen we need facilitators. We need people that have a little bit more competence in IPE and have even competence in facilitation to support the teams in learning and collaborating in the best way, so that they optimize this learning from, with, and about each other. These we need also to be that this is structured and this is a normal part to include the patient in these teams. And as we already heard of Mandana, that these people can help the care teams to address the conflicts they are occurring, but how can we use the conflicts in the collaboration, and how a conflict can actually be a learning situation for the care team, and even to see the different professions, to acknowledge the different professions and to see the different competencies. So we thought we need some people that are acting as facilitators. And here we really connected us with our colleagues for the Center for IPE in the University of Toronto, since they have a course that focus on these people more than now 15 years ago. They have started this course, so we looked on that and had a contact, and I even attended such a course. And then our colleagues from Denmark, it's quite near Stockholm, Sweden, and quite similar healthcare system, have taken the course from Canada to Copenhagen in Denmark, and we have attended the course in Copenhagen, and then we have taken the course actually to Sweden. So this facilitator course has also some kind of journey. Only short that you understand that this is not something that we can do during an afternoon. We have this course is occurring during a whole semester, 6.5 days, and we do it in modules. And we start with a kickoff for the participant, and we even include the leadership. So even the leadership, the managers, the responsible person for the participants are also attending some part of this course. So we're doing it during this whole semester, 2 days each, and then the people our participants have actually some homework to do, or it's more work that they implement what they have learned in the course in the clinical sites. And they're also writing an agreement together with the leadership. So we try to work in this course that there's really an implementation of IPE initiatives can occur. The people attending this course work with the colleagues, really facilitating the interprofessional learning and collaboration with their colleagues, but also with the students. So we see it in the lifelong perspective when we are offering this course and how we work with the content and the facilitation. And we are very proud that we had the first course almost 3 or 4 years ago. Together we have done this course with our colleagues from Denmark. The first facilitator course, you see here the participants and some of us who were teachers in this course at that time. And now we have already done 5 courses in that. And I think strengths in this course are that we involve the leadership, that there's a high interaction between participants, that they work with the different parts that we think are important in interprofessional learning and collaboration, that they can try it out. They facilitate each other's learning during this course. They have cases, they have discussions and so on, that they really do the things that we are teaching hands-on during the course. And they are usually, it looks like a little bit different from term to term, but they are interprofessional groups. They are representing different parts of the healthcare systems. They are different professions. They are different role and different functions. Some are teachers, some are clinicians, some are working with improvement, clinical improvement, and so on. And we think the benefits for the participants and for the organization, we not only have to focus that it is a competence development for the people attending the course. We would like that there's also development and that there's a benefit for the organization where these people are working. So there are many insights, some things that they have known, but some things that they know can work further on, that the leadership gets some kind of collaborative stuff. The people who are attending the course are going to be some kind of collaborator for the leadership, so that they can work together to do the best interprofessional learning and collaboration in the settings where they're actually working. We are talking about many tools, how to facilitate, how to support a good team performance in the clinic, and the tasks that they are supposed to do during course, but even the homework that they're supposed to do between the modules are really authentic and relevant, so that they, for example, facilitate around situations or care planning or development working where they would like to be better in including the patients in the care, for example. Or the knowledge, the things they learn during the course can directly transfer to clinic. You would like to go ahead, Malin?
Yes, thank you. Yeah, and if you talk about the sensibility, why it's so important, we think that one thing is that we have this cooperation with the leadership, the manager, and they have together write this agreement together with the participant. So they, while they go this course, this facilitation course, they talk together how they should do it better for the participant, but also for the workplace. And after they have gone the course, we have this network for all the participants that we meet once a semester. And now in COVID, we have to do it in Teams or in Zoom. So we have talked to each other, meet and talk what's good and not going bad and how you can help each other. And we also follow up the people, the participants, and help them on their own workplace after the course. And we also invite earlier participants under the course so they can share the experience, what they have done that has been good and that could be better. Next, please, Rene. Thank you. Yeah, but what have you seen after these years? Yes, we have learned that if we have this mixed group of participants with a lot of different professions and different workplace, it has been a better outcome in the end. They have they can share a lot together if they are from different places in the region. And we have also seen that it's crucial with the leadership. The management had a lot of things to do, but it's important and it will be a better outcome if we get them into the course, but it's hard to get them into the course. And it takes time and it's also hard to get the participate time to get networking after the training, after the course. So it's sometimes hard to them to get time from the work to work with these questions. Next, Rene. After a while, we see a gap, we see a gap from our interprofessional trainings awards. There we have these supervisions that work with, and we see a gap on the IP competences. So we just a couple of years ago looked on this 2-day course for these supervisions on these IP trainings awards, and that's focused on the facilitation for the IP student teams and the IP supervisions. So you can say that this course is a short version of the 6-day course for just for supervisions that have this defined assessment for these students and these teams. And we have looked, they have a similar in Denmark as well. So we have helped each other to create this one. Thank you. Next one, please. Yes. If we should see during this COVID period and looking back on it, nearly all our program with interprofessional professional workshops and facilitating courses was stopped or reduced because of all focus was in COVID and taking care of the patient. But instead, we have working a lot of COVID-related training from all professions instead, so they can take care of the patients at the hospitals. But during the COVID period, all the student placements has been continued with some adaptations at the hospitals. Next, please. Mm-hmm. And now, new during COVID, what do we learn after COVID? We have seen that there have been many spontaneous collaboration between department, awards, patient, participants to help each other out, to find a solution of all the problems that has been coming up under the COVID. So it has been a lot of interprofessional collaboration that we've seen. It's nice, and we hope that the staff will continue with. And we have also seen that the interest and need of simulation, interprofessional simulation, have been is more now than before COVID. So many will now start with the simulation, interprofessional simulation. Under COVID, we have been done the digitalization, digitalization, and there's been lots of changes under this time. There has been limited technical equipment. In every workplace, they don't have this technical equipment that you need to have this kind of education online. It has been better now, but we have a bit there before you can do it online instead. And we also have seen this limited digital competence of the staff out in the region. Some people are more used to be in front of the computer, and someone has been training more. But we have both seen pros and cons regarding digital courses and meeting. We haven't been traveling a lot in the region. We can be at our workplace or at home. But sometimes we see that you lose a lot apart when you can't speak to each other, take a coffee together. So it's both pro and cons with the digitalization. As I said, there's no verbal communication that is important for our facilitation is a problem in our courses that we can use in the digital room. So we hope we soon can go back again. Yes, and this today, as I said, we hope that we can have both digital and in place teaching and learning from here. We can use both, and we can maybe use flipped classroom and limited time to participants to meet, and then we can learn together in different ways. We have also worked a lot of e-learning and will continue to work a lot of e-learning ahead, and also improve the digital resources so that we can use it on a better way ahead. Next. Any questions, or should we take them later? Sorry.
No, well, thank you, Rene and Malin. There is one question, but I think you have already answered it somehow. But how has COVID changed how the team can come together face-to-face in person? Has that had an impact on the interprofessional collaboration?
Excuse me, may I say, if it's possible, I want to say the question would be asked in the question and answer parts. Is it possible for you?
Absolutely. I was just thinking,
Yes.
has Denise Richardson come along?
Denise. Yeah, thank you so much. Dear Denise. Where are you?
Is she there? Are you there?
Unfortunately, she's gone. I don't know what she is. I think it's about her internet power, maybe. Okay. What do we do, dear professor?
That's why I thought maybe we could go to the questions now, since we can't get connected to her.
Yes, please. And we have dear Professor Elizabeth Kakur here, and I want to ask her if she has any question. Please turn her, turn her microphone on. Dr. Kakur, are you here? Are you there?
Is somebody going to ask a question or not? There's so many people.
Please read the chats, because in the chat room they have some questions.
Yes, that's what I did before. But so there's one question from Tanya Dutton in Halifax. Maybe you can ask the question yourself if you're there. No? Oh, well, it was about how the COVID has changed the team, how the team can come together. And I guess that's what you talked about, and if it has had any impact. Oh, she's muted by the presenters.
Yeah.
Okay, so if the team has been able to come together.
Exactly. If you talk about the clinical teams that working daily, they had continued. Actually, maybe you have thought about not to have the more people than the needed in every meeting, or when you were doing the care planning and so on. But when you're talking about our teams in the courses, as Malin said, we first stopped and then we continued, adapted the courses and have some parts digital. It actually worked out in some way, and Malin said it was limited with digital conditions, the Teams or the Zoom and so on, and you can work actually with the teams digital meeting and talking about facilitation, but you have one part that is missing. These people mostly work really in real life in the clinic with the patients, with the team members. And there you have the non-verbal communication, how the people are looking, sitting, and you see the whole body and you have your whole team round about you. And that you really, really miss in an online course. You can talk about many things. You can even have exercises in the breakout rooms. So we can have some parts of the course actually where the team meets in breakout rooms in Zoom, for example. But it's hard. You miss essential parts when you only do it online. So it's very important that the people really meet together physically. And as Malin also said, we have many things that are queuing during coffee or during lunch, and this networking part is also a little bit more reduced when the people not meet face to face, and some part of the spontaneous interactions are missing in the digital room.
Yes, thank you. Could you say something more about the students that have still been collaborating interprofessionally during the COVID period?
We have actually, as you can see, we have continued with most of the clinical placement actually, and then we have tried to have maybe also reduce the teams or split the teams. And the students have actually continued working in teams, have their introduction day on the interprofessional training ward. They have actually worked with the patients, and we have had the other education situation where more students meets in the clinic. And I think it was not a big issue for the students. They had to adapt, and they did the best of the things. And many of our students, we were looking on the training ward, they are in not the medical students, but the other students, nursing students, OT and PT students, are actually almost done with their education when they're on this ward. So we needed to continue their training, that they actually could be graduated and to started working during the pandemic. So I think it was hard with the student teams not to avoid crowding, but they actually worked with the patient. And if you look on the practical part, they thought they had to think about a little bit more, because you can't go in and out to the patient that you usually do when you have to have all these special things on you to protect yourself. So the processes for the students sometimes were more, they have to think about a little bit more planning. Okay, now we are going in together, or we are going only into the patient. So were forced to think a little bit more instead of going in and out that we otherwise see when we're working with students.
Okay, thank you. There is a comment from Hassan Saimian. We have experiences from having an e-learning in our university, Mazandaran University of Medical Sciences, and throughout in Iran. We have good relationship with the faculty members for promoting education and training affairs, and that is very good. I think one of the important points are actually that the leaders agree with these training training sessions, and especially regarding the facilitator course that we have been running. So I am one of those, of course. So I think it's really important that you are involved in the system. So that's very good. Good to hear that that also works in Iran. So now there is who wants to ask questions. So raise hand in the reactions menu. There are so many.
Dear Professor,
yes,
we have another question.
People. Hard to see now. Maryam, you can have the check who is raising their hand, please.
Yes, but dear Elizabeth asked for the first one in the chat room. She asked about the, can you say more about power structure problems? Does IP look the same from everyone's perspective?
I think I should answer to this question.
Yes, go on.
Isn't it? Case is that we have an infrastructure, as I mentioned, problem in Iran based on the literature, and also the power structure problem is happening because one of the important things is that our manager still they have cultural challenges. Then it's obvious that before they deeply understand that how IPE will help the will help the students which want to finish their work and also go to the real world of the hospital, then they will encounter with some difficulties, as I mentioned before. So it is important issue that there is a need for evidence, and we produced some evidence that I mentioned regarding based on the research that we have done, and shows that the IPE could help them in order to increase the healthcare quality. But still, health policy maker in Iran, unfortunately, doesn't so effectively look at this issue in order to bring some sources in order to make good infrastructure and have some kind of wards that I have seen, which has in Southern Hospital, and get together the students in order to learn from with and regarding about each other. Unfortunately, there is still a lack of I think attitude and enough attitude and knowledge to use it in Iran, and I hope that in future time, based on the evidence that they have produced, their perspective change, and if you look the same to everyone. I mean, I mentioned that regarding the professors, managers, and also even students have some difficulties in case. But the main problem is actually regarding the manager, and the second problem is regarding the professors. And for solving this problem, we consider some faculty development courses at the moment in order to make them aware of the pros of the IPE. And then I hope that after that, health policy makers in Iran make a decision in order to bring this issue into the formal curriculum of the IPE and giving the enough source for us in order to running it in the hospital. Thank you.
Okay, thank you. Any comments from somebody, or Rene or Malin?
Yeah, we can only add that this is, as you said, Mandana, this is really important, but maybe we have better structures in Sweden for that. But it's also, I think we don't have to argue for it, that this is the better way of learning, the better way of collaborate. It's more about how that you discuss in the different programs and in the different clinical settings. How is this can be done in the setting where you actually are, that you have a common perspective on how you do it and what possibilities you have in the different settings, so that you as a team of teachers or a team of clinicians saying the same thing, that you agree, having some kind of agreement what is the way to work, the way to teach in our setting.
Okay, thank you, Rene. There is a comment from Hassan Semir about the that there is in Persian page medical professors' challenges of university. Well, you can read this yourself, and I think that looks very good. That there is initiatives taken. Yes, very good. Okay. And we have no information if Denise Richardson is coming back or not. I can see that Elizabeth Kashour has her hand up. Are you able to communicate, or are you muted too?
Sure. I think I unmuted myself. I just wanted to say that the problem with the power structure and hierarchy is not just in Iran, but in other countries as well. And I think the idea of providing financial, showing that there is a financial advantage is a very good strategy. In addition, I think in the US, I'm sure in other places as well, the other good selling point is to address the issue of safety. And team steps has been one of the strategies to equalize the hierarchy and make it more clear that it's important to be a team, and equally feel free to speak up, and everybody has their own the same value, regardless of what their profession is. So I think team step is one good strategy to stress, to teach as well. But I know about Linköping and the wonderful programs they had for learners. And I think ultimately having students learn together will have the best chance to change the culture. I think that has the best hope, but it will take a long time.
Absolutely, very good. Thank you very much. And those are the things that we have been talking a lot during the years. And the hierarchy is, of course, a main issue in many ways. Well, we've been doing this in Sweden for over 20 years now. And I actually visited Linköping in 1997 before we started the year after in Stockholm. And so it was a great idea from them to start in the clinical work, and I think that is the one of the successes about IPE in Sweden, that it's actually very clinical, and it is in the curriculum, so it can't be taken away easily. So it has to continue until you make a new decision at the university, and that's not the thing you're going to do these days. But I must say that I have been hoping that when all the students during these 20 years have done their IPE course, it would be easier in the real world or the real workplaces. And I think it has become easier, but still you need to continue talk about it. And Rene was just yesterday, or was it the day before, talking to our new residents at our hospital, pointing out the things that you just raised, Elizabeth, and that's very important. Patient safety is one of the keys to make it better for the world and for all the participants, including the patient. Would you like to comment on that, Rene?
No, I can only agree, as you said. So as we also said in the beginning of our presentation, it's you have to have the IPE in every level, from top down and bottom up. You can't only rely on the students. You have to think about the whole system, the clinical system, the training system, and as you said, it has to be in the curriculum. You have the goals that the students have to fulfill, and then the teacher and the clinicians that are supervising the students need to know about it and need to have a plan that the students really can do it. And there are things left to do, absolutely, but I think you see it from year to year that we are coming a step longer in this work.
Yes, thank you, Rene. Okay, do we have some more questions to raise or comments to give? Otherwise, since we are missing Denise, so I don't think we have any more speakers for today. Or what do you say, Mandana? Shall we wrap it up then for today?
Yes. Because I don't know. Here's information about team steps, and
team steps. Yes, that's very good.
Yes.
Thank you.
Thanks, Elizabeth, who is one of the faculty of the United States, and we had also together some webinar before. Thank you. And I think that the wrap up should be happened.
Okay, so I think that this was a very good idea to have this seminar, and there are now 94 participants. That's really a lot of people interested in IPE. Most of you seem to be from maybe from Iran, I think. And I think we had good discussions and highlighted different difficulties and successes in different parts of the world. I hope the COVID situation will change soon. At least we look forward to that in Stockholm, Sweden. But we have, as I said before, we have learned something, so we can have this type of seminars also in the future. Now that everybody knows how Zoom and Team works, that's very good. So I would just like to wish you all luck with the IPE activities, and thank you for participating, and thank you, Mandana, and your colleagues for arranging this seminar.
And I would like to take a memorandum picture. Please, all the participants open their webcam in order to take a photo together.
Okay.
Yes, please.
As there are more people coming in with pictures. Yes. It's so hard to talk to a black screen, actually, with a lot of names, but no faces. Good to see you all.
Thank you so much.
Are you happy, Mandana?
Yes. Thank you very much. And do you take a photo? Did you do it?
Yes. I've taken the photo of the ones that you can see. Okay. Then I wish you a good day, and hope to see you in some other seminar in the future. So thank you very much, and thank you for the arrangement. All right, bye-bye. Bye-bye.
Thank you very much. Thanks everybody for participation. I hope to see you in the next webinar regarding the IPE RPC. Thank you very much. Bye-bye.
Bye-bye.